In the New England Journal of Medicine, there is a report of the association between body mass index and the risk of death. Most previous studies have been done in European populations, but this study was done on Asians. The results are perhaps not what you might expect. In Chinese, Japanese, and Koreans, the lowest risk of death was seen among persons with BMIs slightly above 20, in the range of 22.6 to 27.5. It comes as no surprise that risk was elevated among persons with BMIs higher than that by a factor of up to 1.5 among those with a BMI of more than 35. But the real surprise was that the risk of death was increased by a factor of 2.8 among thin people, those with a BMI of 15 or less. Thus, there is a U-shaped association between BMI and the risk of death being too thin or too fat as being associated with higher risk. However, in Indians and Bangladeshis, there was no excess risk in people with a high BMI, a curious finding that demands further looking. These data lead to an interesting conclusion. Being underweight is associated with a substantially increased risk of death in all Asian populations. However, excess risk of death associated with a high BMI was seen among East Asians, but not among Indians and Bangladeshis. The late Duchess of Windsor apparently said you can never be too rich or too thin. I can't comment on the rich part, but if you're Asian, she was probably wrong on the too thin part. I'm Peter Block, and this is a CardioSource Heart Minute.